Um, I think we should wait 5 more minutes and then we'll start the class. Please inform your other colleague, batchmates, co-batchmates to join as soon as possible. Okay, just for a quick recap. So, first, let me know whether I'm audible or not, or check your mics. Am I audible? Okay. Please check your mic also so that we can interact. Okay. Just quickly let me know when is like when you are hearing that when is your exam? Are you getting any dates or any month? When is it possible to have your AIPJ? Difficult for me to see the chat. अनम्यूट करके प्लीज लेट मी नो अगर किसी को पता है तो. ओके जुलाई थिंक सो. ओके, we'll may wait 2-3 minutes more and then we'll start. See, the way we are studying materia, it's already known to all of you, right? So it's not something that we are going, one by one or we are going alphabetically. So that doesn't mean that it is not covering all any other medicines. So by the end, as we are reaching to the end of the like medicines alphabetically, then you'll probably see that most of the symptoms we have already covered. So, and you'll get to know, and it is actually that will be very easy for you to remember. Okay. So then we'll study those symptoms again. So in that way, like, it will be easier for you. just study what we are discussing in pulse, and then just go through with your medicine. Just read it out. You don't need to memorize it. Just follow the classes and read out your medicines. We'll start from 2:10. It's 2:07 now, so we'll start. Uh, okay. Acha, what I'll just tell you what I am doing. See, suppose if we have studied any medicine, like in a previous class, and if I got any other similar kind of symptom. So what I'm doing that I'm also, adding it in that previous medicine what we have already uh, studied. So suppose, and what you'll also do that it's not that we are just studying in our classes and then you'll shut your uh, copy, and then just whenever you are reading, you'll just only read that copy. What you'll do that you'll also, if you are reading materia, reading out it, and if you'll see any other symptoms which we haven't covered, or probably which might have forgotten, which might be didn't see that, then you please add those symptoms also, and we'll discuss this in the class, so that it will be enriching for uh, by two sides. So that would be beneficial for both of us, both of, like, for me also and for you all also. So try to read it out in that way. Okay. So let us start. So we had covered in a last class up to argentum metallicum. So here, every medicines we do not have any, each and every medicine we don't have that kind of alternating symptoms or any similar kind of symptoms, or also we have, but what all are important, I try to jot that down. So let's just continue with the like upcoming medicines. So argentum nitricum. So first important symptom is this one: eye strain from sewing. Aggravation, warm room from open air. Okay. So eye strain from sewing, which is aggravation in warm room and from open air. So this is in bracket we have natramur and ruta. So we have similar kind of symptom in other medicine. After using eyes at fine work, watchmaking, engraving, looking intently. So which medicine? It is from sewing and this is from fine work. So which medicine is this? Anyone? Please unmute yourself. अगर किसी को पता है तो please say that louder. Anyone? Mm, no one. Okay, so this is Ruta. So the medicine is Ruta. So the second important symptom and one more like suggestions or you would say advice I would like to add if you want to if like for someone like these kind of the type of study if they are getting it confused with this kind of study so if they want it like in an anatomical order or something so they can follow this one book that crack the entrance they can follow that but I find it a little bit boring and this way if we study like in a very comparative way so it will be interesting and it will be easier to memorize also so just for the suggestion if someone is not getting this point or this study so they can follow that way also so the second symptom is diarrhea as soon as he drinks it's a very common symptoms and it is asked very often so diarrhea this one diarrhea after eating or drinking which medicine everybody is sleeping or what Acha, please just let me know whether you can unmute yourself or not. Okay, so this one is arsenic. If you won't like say anything, I won't be understanding whether you people are understanding or not. Let it be wrong. Just say if you're even saying it wrong, and if I'll correct yourself, you'll remember it for sure. So the next one is the bowels are moved as if spasmodic jerks coming out like a shot as soon as patient eats, drinks, or even while eating. Yellow watery stool. Which medicine? Spasmodic jerks. This is croton. Croton tick. It is symptom. Urine passes unconsciously day and night. This is an argentum nitricum. So the symptom which is highlighted through yellow, it is the main symptoms, or it is the mother symptom of this remedy which we are studying. So second, this one, urine involuntary when coughing, sneezing, blowing the nose. Which medicine? Anyone? It's a very common one. See, please get handy your books with you and just go through with the medicine. This one, urine involuntary when walking, coughing, laughing, has to wait a long while for urine to pass if others are present. So this is the differentiating word, if others are present. So this is natramure. So this one is natramure. Okay. Second symptom, impotence erection fails when coition is attempted. This is in argentum nitricum. So in bracket we have agnus, caladium, selenium. So the second similar symptom is present in other medicine is complete impotence, relaxation, flaccidity, coldness of genitalia, no sexual power or desire. Which medicine? No sexual power or desire.
Agnes Castus.
Very good, very good. Please unmute yourself and just discuss. We are not studying, we are just discussing. So it's very good. Agnes castus. This one, no erection uh, even after caress, no emission, no orgasm during an embraces. Which medicine? During an embrace. It's caladium. Caladium. This one, impotence with desire, lewd thoughts, but physically important. So here, lewd thought is your differentiating word. Which one is this? This is selenium. Selenium. Okay. So the other comparative symptom of argentum nitricum, which is very important, and it has come in your UPSC examination also. So this is sensation of a splinter in throat when swallowing. So what are the other similar symptoms? So first is sensation of splinter fish bone or plug in the throat. Which medicine? Sensation of a splinter fish bone plug in throat. Today everybody is sleeping. Which medicine? Heparsulf. Okay, let's move on to the next one. Sensation of a splinter in affected parts, ulcers, piles, throat, ingrowing toenails, aggravation on slightest touch. So the medicine is particularly very prone to the person uh, who is prone to uh, diarrhea, not constipation, very fair, and they have the person or the person is having bleeding piles. Which medicine? Very revengeful, vindictive. Any idea? It's nitric acid. This one, pain in throat, words swallowing below right angle of jaw, as if splinter were embedded vertically. Splinters were embedded vertically. This is the medicine is from Boric. You probably might not have the idea. So this is Dolichos. So sensation of splinter in throat when swallowing, it is in argentum nitricum. Sensation of splinter, fishbone or plug in the throat, where you will see this plug in the throat, that is heparsulf, where you will see that uh, aggravation of slightest contact, nitric acid, splinter-like affection, and then where splinter were embedded vertically, this is dolichos. Second, we have first symptom of arnica is the for the bad effects resulting from mechanical injuries, even if received years ago. So from this received years ago. So this one, bad effects of a long ago injury. Which medicine? Bad effects of long ago injury. Which medicine? आज क्या डिफिकल्ट हो रहा है थोड़ा? अच्छा, ओके, आई विल टेल यू. दिस इज कार्बोवेज. Chronic effects of mechanical injuries. Which medicine? Chronic effect is Hamamelis. And in bracket we have conium. This one, nervous cannot bear pain, whole body oversensitive. Second symptom of Anika. So this symptom, a comparative symptom is this. Peevish, irritable, oversensitive to pain, driven to despair. And you might have remembered that we have already done with this oversensitiveness to pain in probably in our last classes, the comparative study of different medicines. So this one, peevish, irritable, oversensitive to pain, driven to despair. Which medicine? अरे भूल ही बोल दो. This is chamomilla. That's why I've just marked this oversensitive because we have already done this one. This one, pain are felt intensely, seems almost insupportable, driving patient to despair. Driving patient to despair, almost insupportable. So this is the key differentiating word, almost insupportable. It's coffea. You should not go in a hibernation mode. Your exams are very near. This one is coffea. At least if you can't yeah, remember, just see the book while I'm uh, teaching it. This one, pains are intolerable. They drive him crazy. He becomes very restless at night. Very restless at night. Which medicine? Very restless at night. Should not be given in first stage of fever. Patient fears to cross the street.
Aconite.
Aconite. Very good. See, ऐसा ही क्वेश्चन आएगा एग्जाम में. So you should know the differentiating words, or the key word from which we can differentiate it. So that can come in your any type of questions. Straight question, your all the except type of questions. The pattern, the parts from which the questions are coming from, these parts only. So this one. Oversensitiveness to all the senses, more acute sight, hearing, smell, taste. Which medicine? To all the senses, more acute. This is coffea. Coffea. This one, oversensitiveness to pain, great aversion to wind, especially about the ears. We have done this one, but still I'm repeating it. About the ears, if you wherever you see that there's especially about the ears is written, आंख बंद करके, this is chamomilla. Okay? Okay. Let's move forward. This one, everything on which he lies seems too hard. The symptom is of Anika. Bracket, we have pyrogen and bryonia. So, similar symptom, bed feels so hot she cannot lie on it, moves often in search of a cool place, must be uncovered. Which medicine? Cool place. Okay, fine. I'll tell you the other important symptom. The that sleepy but cannot sleep. There's one more symptom, and the person is feels always sleepy, always in a supper, and painless. All the sufferings are painless. Constipated, round, hard ball-like stools, like
Opium.
ship dung.
Opium.
Yes, yes, opium. So this one is a cool place. If wherever you see that it is cool place, this is opium. So in whatever position the patient lies, the parts rested upon feel sore and bruised. Which medicine? This one is baptisia. Bed feels hard, parts laid. This is laid, okay. On feels sore and bruised. Rapid decubitus. This one is the differentiating keyword. Rapid decubitus. This the medicine is very given in septic fevers. There's one word is written high game. Which medicine? High game. The tongue is fiery red.
Pyrogenum.
Pyrogen. Very good. Pyrogen. Okay. This one. Conjunctival or retinal hemorrhage with extravasation from injuries or cough. Symptoms of arnica. So this one, contusion of eye and lid, especially if much extravasation of blood, ecchymosis of leads and conjunctiva. So there's ecchymosis of leads and conjunctiva. Which medicine? Parts affected, feels cold, ascending paralysis. This is also one of the injury medicine. Parts become blue, black. It's which medicine? Leadum. Yeah, leadum pal. Okay. Just check your connections, because let me know if I'm not audible. Okay. So arsenic album. First is cannot bear the smell of sight or food. Acha, while we are studying, book bhi bagal mein rakho and tally the symptoms. And those who are all which symptoms have already, comparable symptoms, but we have already done it in the previous classes. I have not added here, though it is present in the this particular medicine. So I'm not repeating it. So okay, cannot bear the smell of sight of food. In bracket, we have colchicum and sepia. This one, smell painfully acute, nausea and faintness from the odor of cooking food, especially fish, eggs, or fat meat. Which medicine? Anyone? It is in bracket only. कोई भी एक होगा ही. Which one? The medicine has the symptom of scraping of intestines.
Colchica.
Yes, colchicum. And the very important symptom of colchicum, which comes very often, is that symptoms, pains go from right to left, probably right to left. We'll come to that. So this is colchicum. ऐसा ही आएगा question. I know it's confusing, but ऐसा ही आता है. This one. This one everybody can know. If that is colchicum, this is sepia. So morning sickness of pregnancy, the sight of tough or food sickens, the smell of cooking food nauseates. So this is sepia. Morning sickness of pregnancy is added here. So it is the differentiating keyword. Okay. So asthma, very, very important line, that breathing asthmatic must sit or bend forward. This is of arsenic album symptom. Now this one, asthma must bend head back and sit up. Which medicine? The medicine is very prone to cold, very sensitive to cold. Every little injury suppurates. This one is Heper sulf. This one, asthma, dyspnea, aggravation in open air, sitting up, lying down, and keeping warm. You should tell this symptom. See, I've marked
Suriname.
also. Sorinum. Very good, Sorinum. This one, asthma relieved when sitting up or bending forward or by rocking. By rocking. This is the differentiating word, by rocking. Words from 2 to 4 a.m. Which medicine?
Calicar.
Calicar. Very good. This one, rose cold. एक ही medicine में. Which?
Sanguinaria.
Sanguinaria. Very good. Sanguinaria. Now you have come in form. Okay, this one, dyspnea or asthma where the patient can only breathe by standing up. It's the urine. Yeah, very good. Cannabis sativa. Cannabis sativa. Okay, this one, bad effects from decayed food or animal matter, whether by inoculation, olfaction, or ingestion. This is a symptom of arsenic. This one, bad effects. After bad effects from spoiled fish and decayed vegetables.
Carboanimalis.
Very good, carboanimalis.
मैम कितने स्लाइड्स ऊपर हो गए मैम?
ऊपर करूं?
अभी ज्वाइन किया मैम. हाँ, स्क्रीनशॉट लेना
ओके,
था मैम.
अच्छा अच्छा. We started from here. Let me know when you finish.
मैम कर लिए मैम. ओके मैम. हो गया मैम. हो गया मैम. हो गया मैम.
मम्मा
एक मिनट.
वो 10 रुपए टंग गए हैं। मम्मा
हो गया मैम.
मम्मा
थैंक यू मैम.
Okay.
कंप्लीट हो गया.
Okay. So this one, ailments from quinine, specially suppressed intermittent abuse of mercury, salt meats, spoiled fish, meats or fats from getting overheated. So here your differentiating word I've already marked it. It's from quinine. So which medicine?
Cinchona.
No, just because it is written Quinine. No, it's not cinchonine. It's carboveg. The medicine is carboveg. अच्छा in this one, that spoiled fish and ये वाला जो category है, I think there are other medicines also which I'm forgetting probably. If you find it, you add it. It's your homework. Just check pyrogen में है, मतलब similar kind of कुछ नहीं, or those were decayed type of things, just add. So this one, complaints return annually. So we have numerous medicines, carboveg, sulfur, lachesis, puja. But you need to understand here कि सब में the lines are not like similar annually. So annually is there, but what different disease condition is there, which comes, annually, returning annually. So we can take it like this. P fever annually returning paroxysm every spring after suppression by quinine the previous autumn. Which medicine? And sulfur, actually, it is not written, annually. It is written that relapsing, continually relapsing. So I've not added that. So see this one, fever rate, and this is very important line. The line is very important one because it has come in numerous competitive examinations. So fever and this one is lachesis. Lachesis. Okay. Okay, just leave this part. It's not from this medicine, vomiting one. We'll start here. Aram triphyllum. So, aram triphyllum, we have already, there's one very, very important symptom from stopped up nose. So, we have already covered in the last class, like in our previous classes from ammon carbs. So, see that lecture. And first symptom is this important one, pick lips until they bleed, corners of mouth sore, cracked breathing with malignant tendency. Bracket, we have Condurango. With my bracket, cracked bleeding, but if there's a malignant tendency, the medicine is Condurango. So ये वाला भी बहुत बार आया है यूपीएससी में, Condurango जो है. Then the second symptom is very subject to chancre, sores in the mouth, canker or chancre, whatever, sore in the mouth. Which medicine? The medicine is aggravation, ailments from overheated, ill effects of sunburn, there is bots, corns. Child is very ugly looking. No one? This is antimcrude. I know this is very uncommon, but question आया है ये. Antimcrude. This one, corners of mouth ulcerated, fever, blisters around the mouth and chin. Which medicine? A very common medicine, which is given in, extremities, complaints of extremities, aggravation of first motion, amelioration by continued motion. Which medicine?
Rustox.
Rustox. So this is Rustox. See, पढ़ते आप लोग सब हो, but ये अब जब पढ़ोगे तब ये दिमाग में घुस जाएगा और ये निकलेगा नहीं कभी. And this is the beauty of materia. Rustox. This one, easily ulcers, easily bleeding in corners of mouth.
Aramtipilum.
No, this is not aram. So this aram triphyllum is what we are studying. This one is nitric acid. एसआरएम का एक बहुत इंपॉर्टेंट है symptom regarding that alcohol things. We'll cover it up दूसरे वाले मेडिसिन में. So this important, this one is important. Great faintness and constant yawning. It's a symptom of asaram. Now this one, profound and repeated yawning. Which medicine? ये क्वेश्चन आया है one of your AIPGT exam. This is amyl nitrosum. एकदम लास्ट लाइन में दिया हुआ है शायद, एकदम लास्ट रिलेशनशिप के पहले. अच्छा, एस्टेरियस रूबेंस वी आर नॉट कवरिंग इट अप क्योंकि उसमें जो इंपॉर्टेंट सिम्टम था वी माइट हैव कवर्ड इट, और जो है that is not that comparable one. So those I'm not covering it up. Don't think that we are skipping that. So it is not that important as per your comparable one. But we have some lines which are very important. Just open your book. I'll tell you. So this symptoms. This one. See this line. Gait unsteady, muscles refuse to obey the will. We have already covered it in comparative study. This so constipation, sexual desire increased in women. The line is very like that comes very often. This line is very important. So sexual desire increased in women. In bracket there's Lilium take last line जो है. So please mark it or remember it. If you don't want to mark it, just remember. So aurum metallicum, prolapsed. Prolapsed and indurated uterus from overreaching or straining. We have podo, rustox in bracket, and from hypertrophy, sconium. So this line, similar line is prolapsus uteri from overlifting or straining from constipation after parturition with subinvolution. So this one is your differentiating word. So after parturition with subinvolution, which medicine? The medicine is very useful in diarrhea, jet-like diarrhea, yellow watery diarrhea. There's fever, paroxysm. Okay. Baptisia. This one, it's very important. Can swallow liquids only. Less solid food gags. The symptom is baptisia. Now this one, can swallow liquids only but has aversion to them. Which medicine? No one? It's Silesia. This one is Silesia. Aversion to them is Silesia. I think in bracket only it is given. Silesia. Okay. So the second one, inability to swallow anything but liquid. Which medicine? This is also in bracket.
Nickets.
It's Beraita. Beraita carb.
Right, का.
Yes, Beraita carb. So this symptom from Beraita carb specially adapted to complaints of first and second childhood in the psoriatic and tuberculosis. Another medicine is specially adapted to children and old people, diseases of first and second childhood. Beraita and millefolium are in brackets. So which medicine? This one is opium. ओपीएम का पहला लाइन है यही वाला ओपीएम. Pens are sometimes. So this is opium. Okay. मिलीफोलियम में ऐसा कोई लाइन नहीं है, I've checked. ऐसा कुछ नहीं है लाइन. Okay, this one. Old cachetic people scrofula, especially when fat or those who suffer from gouty complaints. It's a symptom of Varieta carp. So similar complaints of old age, of premature old age in syphilitic, mercurial dyscrasia. Young people look old. Young people look old. Which medicine?
मैम
क्लोरिक
अ,
एसिड.
मैम
Yeah,
कैलकेरिया फॉस में वो फर्स्ट एंड सेकंड डेंटेशन दिया है ड्यूरिंग.
first and second dentition. Acha, let me see we can add it or not. Line एक बार बोलो क्या line है?
During
Calcaria
first and
first का.
second dentation of scrofulous children, diarrhea and great flatulence.
सी डेंटिशन नहीं इसमें ऐड कर सकते हैं. क्यों नहीं ऐड कर सकते हैं? बिकॉज अलग से यू कैन ऐड इट. एक मतलब ब्रैकेट के अंदर एक दे सकते हो याद रखने के लिए कि सिमिलर ग्रुप है, बट यहाँ लिखा है फर्स्ट एंड सेकेंड चाइल्डहुड. ठीक है, वो चाइल्डहुड जो है दिस इज रिटन इन ओनली इन ओपीएम, नॉट इन अदर मेडिसिन. सो यस यू कैन डेफिनेटली ऐड इट. जस्ट गिव अ थर्ड ब्रैकेट और इसमें बीच में ऐड कर देना, ताकि व्हेन यू स्टडी ये वाला ग्रुप को एक साथ में पढ़ लो. वेरी गुड, थैंक यू फॉर एडिंग दैट. So complaint, this one is acid flu. Ye- acid flu. Third symptom of Beraita is, this is very important. Okay, suppuration. Prone person subject to quinsy. Quinsy word I've already told I think in previous class that it is written in three medicines. One is Beraita and rest is two. So this one. और कहीं पे भी एलन में नहीं मिलेगा. So quinsy when suppuration threatens. Which medicine? This is paper sulf.
पेपर सेल्फ.
Yes, very good. This one, quinsy tonsils greatly swollen, difficult, painful, swollen. This is in Suriname. है एलन में तीन जगह ही मिलेगा. One is your Beraita, second is Heper, and third is Suriname. Okay. Second symptom, offensive foot sweat, toes and soles get sore of heels and throat affection after checked foot sore. This is a symptom of Beraita. This one, foot sweat between the toes, making them sore, offensive on soles, as if they had stepped in cold water. See this one, what I'm marking it, it's the differentiating word. So, which medicine is this? The medicine, the child has a sour smell. Achha, I'll tell you. It's sanicula. इसका ब्रैकेट में है दिया हुआ, बट आप ओमिटेड द ब्रैकेट जस्ट टू दैट. ब्रैकेट देने से थोड़ा इजी हो जाता है, बट एग्जाम में तो you won't be getting brackets, right? Okay, this one. Ailments caused by suppressed food sweat. Ailments. This one, it's silesia. Okay. And the last symptom of Pereita, which is important, is great sensitiveness to cold. So this is the last line of Pereita. Here, great liability to take cold. क्वेश्चंस ऐसे ही आएगा. सो ग्रेन सेंसिटिवनेस में बेराइटा हो जाएगा, Great liability to take cold. Which medicine? There's a coldness in single parts, general coldness. Person is very flabby,
Calcarea.
profuse calcarea, profuse head sweat. So this is calcarea, carb. This one, very much inclined to take cold. Cali carb. Great sensitiveness to cold air or change of weather. It's sorinum. Is important. Great sensitiveness to cold is Berita carb. Great liability. Common symptom of carb group. But great sensitiveness, Berita, great liability, calcarea, very much inclined is cali carb. Great sensitiveness to cold or changes, sorinum. See, this one I've added that in all the other three medicines, they have same lines, not similar, same lines. Sleepy but cannot sleep. But ये question आता है your that one, all of the above or A, B, B, C one. So that's why I've added it. Okay. So this one, boring the head into pillow. Second symptom of belladonna, boring the head into pillow. This one, boring the head into pillow, rolling from side to side, beating head with hands.
Protophyllum.
Which medicine? No, not.
Proto-
It is not podophyllum. Yeah, definitely one of the symptom has the medicine podophyllum, but not rolling from side to side. This is in Helleborus. Helleborus. And this one is podo. Head hot and rolling from side to side. Head hot. But here boring the head into pillow and beating head is added. So this one is podo. You are partially correct. And rolls the head from side to side. Which medicine? This one is zincum. See, I know the gap is like the gap has happened a lot while we had, the last discussion in Materia class. But what you'll do, you'll find these kind of symptoms, unless we, meet in our next class. So that you will, see the pattern, how like the question is coming. Okay, so the second important is the symptom is rash before and during the menses. Belladonna. This one, rash before menses, not during, only before menses. Which
Jalkamara.
medicine? Very good. Dalkamara. And in bracket, we have conium also. This one, eruption on face of young woman, especially during scanty menses. Which medicine? This has right shoulder rheumatism. Anyone? Okay, I'll tell you. This one is sanguinaria. Sanguinaria in bracket we have Bellis, Calcarea, Eugenia, Sorinum. Bellis, Calcarea, Eugenia jumbo, and Sorinum. ठीक है? This one, itching eruptions on forehead during menses. Forehead, Which medicine? This is Pygelia. This one is Pygelia. This one, last one. Menses with rash of small red pimples over body which ceases with the flow. This is conium. So rash before and during is belladonna. Before menses is dulca. Eruption on young women, especially during scanty menses, is sanguinaria. Itching eruption on forehead is pygelia. Menses with rash of small pimple which ceases with the flow, that is conium. Okay. Now this one, vertigo. Vertigo when stooping or when rising after stooping. On every change of position, is your belladonna. Okay. This one, vertigo with tendency to fall backwards. Which medicine? Anyone? Acha, I'll tell you. This is from, the medicine is from boric, and the question comes. Okay. So this is your absinthinum. थोड़ा थोड़ा बोरिक का भी what you'll do कि सक्सेस में जो सारा है ना एकदम अच्छे से पढ़ लो सक्सेस में क्वेश्चन जो है बोरिक का. And one question also come from this absinthinum, that what is the common name of absinthinum in your materia? ये भी बहुत बार आया है. That is wormwood. Worm. Okay. This one, vertigo with a tendency to fall forward. Backward तो है, forward. This is also from boric, that is carduous. इसका भी कॉमन नेम आता है मैरिज थिस्टल. All right. Common name is Mary's thistle. This is the common name of carduous. So tendency to fall backwards, absinthinum. Common name is wormwood. Now tendency to fall forward is your carduous. Common name is Mary's thistle. These two are very, very important. Now this one, vertigo falling forward. Fall forward now, falling forward. This is in your Viburnum opulus. Opulus. Okay. Closing eyes, this is, you should tell this one. Closing the eyes. Theridion. ब्रैकेट में क्या है उसके, क्योंकि ये क्वेश्चन आता है, ब्रैकेट भी साथ में आता है. दिस इज लैकेसिस एंड थूजा. 3 medicines बेसिकली. ये वाला ओपनिंग, दिस वन tobacco. Looking upward,
Oculus.
no. Looking upward is pulsatilla and silicea.
Pulsatilla.
2 medicine. Very good. Pulsatilla and silicea. Looking down, which medicine? Calmia spigelia. Okay, this one, vertigo when stooping or looking down.
Belladonna, bryonia.
No, this is also in Calmia. Bracket में silicea दिया इसके. Belladonna तो I'll tell you, belladonna तो यही था. This one, belladonna. Yeah. Vertigo when stooping on rising after stooping on every change of position. On every change of position, why I'm putting effort on this, that pressure, because this is the differentiating word. This one, vertigo when looking down, calmia spigelia, but vertigo when stooping or looking down, both calmia. Bracket में spigelia. Vertigo, especially when lying down or turning in bed.
Conium.
Very good, conium. This is conium. This one, vertigo when quickly turning head, especially to left, as if he would fall.
Colocynth.
Colosine. Very good. This is colosine.
मैम बट इसमें लेफ्ट दो
क्या है?
मैम शायद लेफ्ट जो है ना कोनियम में एंड कोलोसिंथ में दोनों में मतलब दिया हुआ है तो मैम डिफरेंशिएट
अच्छा 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 वेट, कोनियम में क्या है? तुम कोई रीड आउट करो, आई ऑल्सो चेक. Especially when lying down or turning in bed, moving the head slightly or even the eyes. This one. Must keep head perfectly still in turning to the head to left. Acha, this one you're saying, the full symptom. In turning the head to the left and colosynth में what it is given. Wait. In colosynth, when quickly turning head, especially to the left. So here, see, especially to the left, and in conium, what it is given that. There's this one. In turning the head to left. See, in turning the, I'll tell you this one. In turning the head to left. Head to left. And यहाँ पे specially to the left है. तो ये जो specially है, you need to differentiate with this word only. Okay. So vertigo, especially when lying down on turning in bed, added रहेगा. अगर left वाला भी दिया है, तो that was added. That would be added with that symptom. So अगर lying down and turning bed with the with left tendency or turning the head to left is written, that is conium. And if it is only written vertigo when quickly turning head, especially to left, as if he would fall, that is only colosine. Okay. Okay, this one, vertigo on descending. Anyone?
बोरेक्स.
No. I know, descending सोच के ये बोरक्स आएगा याद, but this is ferrum. Okay, this one. Vertigo sensation as if falling into the left. See, this is also left, but falling into. That was special. That was the head to left. So this is falling into. This one is eupatorium. So this one is eupatorium. So we'll quickly recapitulate this vertigo situation here. So this one, vertigo when stooping on rising on every change of position, belladonna, tendency to fall backward, absinthium, fall forward is carduous, falling forward is viburnum, closing the eyes is theridion, laches is thuja, opening is tabacum, looking upward is pulsatilla silicea, Looking down is calmia, spigelia, but vertigo when stooping or looking down is both is only calmia. Bracket में spigelia है, but remember calmia. Vertigo, especially when lying down or turning the bed, plus in turning the head to the left is conium. Vertigo when quickly turning that, especially to left as if he would fall, that is colocin. On descending is ferrum. Fall sensation as if falling into the left is eupatorium. So this was about your vertigo. Now benzoic acid, one symptom, diarrhea of children, white, very offensive, exhausting liquid stools turning the right through the diaper. Okay. So similar is diarrhea of children during teething, after eating, while being bathed or washed of dirty water soaking through the napkin. Which medicine? With gagging, soaking. पहले भी हम लोग कर चुके हैं इसको सिमिलर में, एलो में, डायरिया. Which medicine? It's podo. Someone was saying anything?
No, ma'am. Mark बोल रही थी.
Okay, okay. अच्छा. Benzoic acid, this one is important. And one question आता है, cater of bladder after suppressed gonorrhea. तो जब हम लोगों ने gonorrhea किया था, that maltreated gonorrhea and Merck, वो वाला comparison, तो उसमें we had added, so I didn't add that one here. चलो. तो अगर वो कुछ कवर नहीं करेंगे तो रिमेम्बर दैट कि वी हैड ऑलरेडी एडेड, तो उसको प्रीवियस वाले क्लास में देख लेना. अगर कोई कंफ्यूजन होगा तो आस्क मी देन एंड देयर. अच्छा, बर्बरीज. सो दिस वन इज शॉर्ट कफ एंड चेस्ट कंप्लेन स्पेशली आफ्टर ऑपरेशन ऑफ फिस्टुला, calcaria fos and silesia. So the similar like symptom is like fistula and this one, heart complaints. So we have two medicines. One is this one, fistula and nano, alternating with chest symptoms. Chest complaints, not symptoms, sorry. Which medicine? Complaints. Symptom है. इसी में medicine change. जिसमें complain है, C for complain. So C for calcaria. I don't know, this is my way to remember. If that helps you, you can remember it like this. And if it is symptoms, so S for silesia. I hope अब गलती नहीं होना चाहिए इसमें. So chest complaints is calcaria fos and symptom is silesia. Okay, this one. Stitching, cutting pain from left kidney following course of ureter into bladder and urethra. Bubbling sensation, both are from Berberis. Now this one, renal colic, violent spasmodic pain along the ureter left side. Which medicine?
Sarsaparilla.
Left. No, this is left, but this is not sarsaparilla. This one is tabacum. Tobacco. This one, renal colic, intense pain in ureters with sensation of passing of calculus. So that bubbling sensation here, that is that denotes that calculus is passing. See, if you see that Berberis में their medicine, ये जो दोनों medicine है, that is given in bracket only. So this one, renal colic, intense pain in ureter with sensation of passing calculus, this is Medo. Now, very important, bismuth. Toothache by holding, toothache amelioration by holding cold water in mouth. We have brainia, coffea, pulsatilla, and other also. So toothache intermittent jerking relief by holding ice water in the mouth but returns when water becomes warm. Which medicine?
Bovista.
No, this is not Bovista. This is ice water is Coffea. बोविस्टा में ऐसा नहीं है, मतलब सिम्टम ही नहीं है ऐसा कुछ टूथेक वाला ना. Now this one, toothache relieved by holding cold water. Which medicine?
Coffee.
No, coffee तो पहले वाला था. This one, cold water. Ice water is coffee. Cold water is pulsatilla. This one is pulsatilla. Okay. Toothache amelioration by cold water and cool air. Cool air is added. Which medicine? It's a natrum salt. See, bracket में भी ये medicines नहीं है, but we have similar symptoms, right? So cool air is natrum sulf. Cold water only is pulsatilla. Where icy water is there, it is coffea. And this one, toothache, if anything warm is taken into the mouth. This is chamomilla. Okay. Vomiting. So important symptom of bismuth is vomiting of water as soon as it reaches the stomach, food retained longer. So we have similar medicines. Vomits food and water. Which medicine? Anyone?
Arsenic.
Very good. Arsenic. This one, as soon as water becomes warm in stomach, it is thrown up.
phosphorus.
Very good. Phosphorus. So this is phosphorus. This one, vomited as soon as it reaches the stomach.
Bismuth.
Bismuth.
Bismuth में तो है. Bismuth we have studied, and but bismuth make added a food retained longer. But here it is not added. Food retained longer. This is only symptom, vomited as soon as it reaches the stomach. This one is sanicula. See how it is changing, how the medicine is changing. Here, food retained longer. Here, food retained longer is not written. So this is sanicula. Borax. Child has frequent urination and screams before urine passes. ये इसमें मतलब personally मुझे बहुत confusion होता था these two lines. So this one is screams before urine passes, and this one sand in urine or on diaper. Child screams before and while passing it. Which medicine?
Lyco.
Not लाइको. अच्छा लाइको में कुछ है क्या ऐसा? अगर
रेड
है तो
सैंड
we can,
करके कुछ है शायद.
क्या है एक बार बोलो तो. So we can add that one. This is sarsaparilla. हाँ सैंड करके कुछ है.
रेड सैंड.
Anyone please. हाँ पूरा
रेड
पूरा
सैंड है
सिम्टम
शायद.
बोलो. पूरा सिम्टम बोलो. पूरा क्या है सिम्टम? We can add that then.
Before urine passes
Read
was
it out.
sulfur.
Sulfur is also there. Acha, what is the line? Red sand in urine on child's diaper. that is in LICO.
Child's
ठीक है?
lico.
हाँ.
Bracket में
So you
phosphorus.
can add that one. And child cry one also. This one, this LICO. Please add LICO. Here I'm not writing it. I'll just write the medicine. Add LICO. These are very irritating. ऐड कर लेना LICO, ठीक है इस पे. अच्छा, सल्फर का someone was saying सल्फर कुछ है ऐसा सल्फर में? Please check. It's very like good to like discuss, no? Sulfur, do we have anything sulfur? So please read it out. I'm also trying to see. मुझे तो नहीं मिला. मिला किसी को तो प्लीज ऐड करना. विल मूव फॉरवर्ड. चलो, विल मूव फॉरवर्ड. This one, second symptom of borax, that skin unhealthy, slight injury suppurates. It's a very, very important symptom. So this one prevents excessive suppuration. Which medicine?
Licia.
This one is salicylic acid. Calendula में दिया है. You can check. Relation part में maybe. Salicylic acid in bracket. This is calendula. This one, the slightest injury causes suppuration. So this separation wala part is also very important. So question to आएगा ही. The slightest injury causes suppuration. Slightest. This is Heper.
Calendula.
No, this one is Heperson. This one. Unhealthy skin, every injury suppurates. Every.
Alicia.
Licia.
No, this is graphitis. This one, glandular swelling with or without suppuration, but especially if suppuration be too profuse. Glandular. This one is mercurius. This one. Unhealthy skin, every little injury suppurates. See, this is silicea. In silicea, it is little, it has added. But in graphitis, you can see here, every injury suppurates. So little, ये word में ही medicine changes. Can you see now? So graphitis, every injury suppurates, and silicea, every little injury suppurates. And this slight injury, which medicine? It's petroleum. Okay. Eruption
मिनट
easily
मैम
suppurates.
मैम
हाँ
एक
हाँ
मिनट
हाँ, sure. So skin unhealthy, slight injury suppurates. Slight is this medicine, this one what we are studying now. Borax, slight injury. Okay. And then prevents excessive suppuration is salicylic acid. Slightest injury is hypersulf. Unhealthy, every little is graphitis. Sorry, every injury suppurates graphitis. Every little is silicea. Glandular का अगर कहीं पे आएगा, that is mercurius. Slight injury is petroleum. And this one, eruption easily suppurates. आज C complete कर देना है, we'll move forward. It's not that C complete or A, B complete. We are completing like as a whole. Okay. So this one, eruption easily suppurates.
सल्फर सोनाइलम
It's sorinum. Sorinum. Okay, this one, aphthous. Borax का है, aphthous. This aphtha in mouth, on the tongue, inside of the cheek, easily bleeding when eating or touched, prevents child from nursing with hot mouth, dryness, thirst. This one, aphtha of mouth, gums, or entire buccal cavity, gums bleeding readily, ulcer, painful, offensive breath. Which one?
मर
Yeah, tell me.
मर्क मर्क
Oh, no, not mark. This one is
Staphysagria.
not Staphysagrina. This one is sulfuric acid. Okay. This one, tenacious. Discharge from nose and all the mucous membrane, every tough, stringy, tenacious. Stringy, tenacious. This is bovista. Now this one, discharge of tough, stringy mucus which adheres to the part and can be drawn into long string.
Calibacrum.
Which medicine?
खाली
Very good.
खाली बाई
Very good. This one, saliva, tough, ropey, viscid, frothy in mouth and throat
Mark.
with corn.
क्रॉकस
No, this
क्रॉकस
is not mark. No, this is not crocus. Crocus में भी है ऐसा. I haven't added. I'll add it. This one is lysine. This one, tenacious mucus from the air passages. Which medicine? Air passages. It's cancerous. अच्छा, crocus में भी है ना? I didn't add that. What is the line? Please, someone read it out. Okay, yes. Please add crocus. That hemorrhage from any part, blood black, viscid, clotted, forming into long black strings hanging from the bleeding surface. Very good, thank you. So please add crocus here. And इसका bracket में there is elapse. Please add crocus. Bracket में elapse भी दिया है. Okay. So intolerance to tight clothing around the waist. We have calcarea, lachesis, and sulfur. This one, which medicine? This one is the bovista, that yellow one, and this one, intolerance
ये
of tight.
amyl
लैक्टिक
Amyl. This is lactases. अच्छा, amyl में है ऐसा कुछ? एक बार check कर लो. If you have confusion, I'll also have confusion, so we just check.
नहीं मैम, एमाइल नहीं बोलना था मुझको, ब्रोमियम बोलना था। दोनों में ही सांस के लिए दिया जाता है, तो मैं दोनों कंफ्यूज कर लेता हूँ,
Oh,
बट
अच्छा, नहीं,
ब्रोमियम
Oh,
बोलना था।
अच्छा. Okay. So this one, intolerance of tight bands about the neck and waist is lactases. Okay, this one, it's hemorrhage. It's a short form I've written. So hemorrhage after extraction of tooth. This is bovista. And this one, hemorrhagic diathesis. हाँ, बोलो.
एमाइल में दिया है नेक में कि कॉलर सीम्स टू टाइट, मस्ट लूज इट, फिर ब्रैकेट में लैक्टिक।
Okay. अच्छा, हाँ, you can add that one. मैंने भी देखा था इसको, बट ये वेस्ट का दिया था इसलिए मैंने नहीं किया, बट हाँ, यस, इफ इट इज लैकेसिस इज देयर, डेफिनेटली यू कैन ऐड योर amyl. Please add amyl also. Amyl nitrosum, please add. See, discussion से this happens. So materia is a never ending subject. ऐसा नहीं है कि एकदम हम लोग मटेरिया एक बार में पूरा ही ये कंपैरिजन खत्म ही कर लेंगे. When as soon as far as you study, जितना बार पढ़ोगे उतना बार नया नया कुछ निकलेगा. Add amyl. Yes. Thank you for this. Okay. So this one, hemorrhagic diathesis after the extraction of a tooth, which medicine?
क्रियोसोट।
क्रियोसोट।
Very good. This is creosote. This one, bleeding from cavity after extraction of tooth.
स्टेप।
This is trillium pendulum. Trillium. Okay. अच्छा, ब्रोमियम में ऐसा कुछ मतलब कंपैरिजन का था नहीं, which was left to do. So I just skipped that one. Read out कर लेना तुम लोग इसको. I'll tell you which क्वेश्चन जो आता है इसमें से. हाँ, एक सेंसेशन ऑफ कॉबवेब ऑन द फेस है जो, the bracket में बेराइटा बोरस. This can come in all of the above type of question, and fan like LA this one. बाकी there's nothing important like ऐसा वाला कुछ, so I just skip. Okay, so this Brainia, vicarious menstruation, nosebleed when menses should appear. Second, we have hemoptysis, vicarious from nose, stomach, anus, urethra, and amenorrhea. Which medicine? Bracket में ही तो दिया था. No, not hemamine. This one is phosphorus. इसके bracket में ही है. This symptom, cough entering a warm room, is a symptom of brainia. This one, cough going from warm to cold.
पल्सेटिला।
एलियम।
This one is phosphorus. एलियम सेपा में कुछ है ऐसा? देखो.
हाँ है।
अच्छा, क्या है एलियम में? प्लीज रीड आउट करना.
वार्म रूम में एंटर करने से कफ होता है, उसमें भी सेम ही था।
अच्छा, एग्जैक्ट लाइन क्या है वो लाइन देखना होगा. There's a cough or a general aggravation modalities tha. What was that? Coryza, profuse, watery, and acrid nasal discharges. No, that was not there. प्लीज अदर्स ऑल्सो, तुम लोग भी देखो, अगर मिलेगा तो लेट मी नो. हेडेक. There's a catarrhal dull headache with coryza, aggravation in the evening, amelioration in open air, aggravation on returning to a warm room. So that is catarrhal dry headache, not cough. ठीक है. एंड भी ऐसे भी जनरलाइज कर सकते हैं कि यहाँ पे एमिलोरेशन भी दिया है कि इन कोल्ड और वार्म रूम, बट यहाँ पे you can add it in a third bracket, but that was not cough, that is catarrhal dull headache. ठीक है. चलो. Headache pressing like a heavy weight on vertex, cactus. This one. Headache pressing in vertex from above downwards,
Menianthes.
amelioration. Very good. Menianthes. Aggravation, ascending. So this one, menianthes. Okay, palpitation. This is very important. Palpitation day and night, worse when walking and lying
Glonine.
on left. Uh, Glonoid. This symptom is of cactus only. Palpitation day and night, worse when walking and lying on left side, and approaches of menses. जहां पे approaches of menses दिया है, that is cactus. This one, palpitation violent when lying on left side, amelioration turning on right. Which medicine?
Lachesis, ma'am.
नहीं, lachesis नहीं है. L से ही medicine है, but not lachesis. This one is laccan.
Lac-
Laccan. Okay. ग्लोनॉइन में दैट्स नथिंग लाइक गिवन राइट एंड लेफ्ट से कुछ नहीं है, ऐसे ही इन जनरल है. अच्छा. दिस वन. Palpitation violent when lying on left side, goes off when turning to the right.
Tabacum.
Very good. This is tabacum. Okay. Impotence with mental depression, relaxed penis with sexual desire and excitement. This is a symptom of caladium. In bracket, we have lyco and selenium. Now this one, impotence of young men from onanism or sexual excess, penis small, cold, relaxed, old men with strong desire, but
Lyco.
imperfect erection, falls lyco. Very good. Premature है तो lyco है. ये देखना, premature. This one, impotence with desire, ये तो we did अभी last में. Which medicine? Lewd thoughts
Zarsa.
in this? No. Selenium. This one.
Selenium.
Complete impotence, relaxed flaccidity, coldness of genitalia, no sexual power, no desire. This
Agnus.
one also we did. Agnes. Very good. अच्छा, this is lyco, ये दोबारा से ऐड हो गया. चलो. Complaints of drunkards after abstaining, craving for alcohol. This medicine, this is a calcarea arsenic symptom. Brackets, asaram, sulfuric acid. Which is this with this symptom?
Asaram.
Asaram. Very good. So asaram. अच्छा, सल्फ्यूरिक एसिड में कुछ है क्या?
यस मैम, हेरिडिटरी टेंडेंसी उसमें
ब्रेंडी,
है।
उसमें ब्रेंडी वर्ड है।
सिफिलिनम में है।
अब आपको गर्ल बना, गर्ल से
Sicilian.
गर्ल।
अच्छा, let first see that. अच्छा, brandy वाला तो will add this water drunk causes coldness of stomach unless mixed with alcohol liquor. Syphilinum में क्या है? Please read it out.
Craving alcohol in any form, hereditary tendency to alcoholism.
That is in syphilinum, right?
Yes ma'am.
Okay, then please add syphilinum also. Uh, Here add syphilinum. Add syphilinum. Okay, thank you. Calcarea card. Head sweats, वो brandy वाला part will cover it in other medicine. Okay. So calcarea carbs, head sweats profusely while sleeping, wetting pillow far around. This is a symptom of calcarea carb. Now this one, head and neck of children sweat profusely during sleep. Wets the
Canicula.
pillow far around. Sanicula. Very good. This is sanicula. This one, sour odor of the whole body. This is a symptom of calcarea carb. Now this one, diarrhea of children with sour smell. Which medicine? Anyone?
आर से एक मेडिसिन है, आर वाला मेडिसिन।
रियूम में
Rheum में भी है, but this is Heparsal. ये वाला, sour smelling of whole body, child smells sour even after washing or bathing. This one is Rheum.
Rheum.
Rheum. This one is Rheum. R वाला जो medicine है. This one, sour smell of whole body.
सूरिनम में भी है शायद।
है, but ये वाला नहीं है. This line is not from Suriname.
एंटियम क्रूड में भी है।
Antim crude, इसको याद रखना. But this one is mac carb. Antim crude में क्या है?
बच्चे को नहाने से भी उसका सावर स्मेल रहता है शायद, कुछ था।
Sour लिखा है उसमें. अच्छा, एंटिम वाला तुम लोग ढूंढो, मैं ये वाला कवर करती हूँ. देखो ये, child has a sour odor despite careful washing. Which medicine?
सल्फर।
Sour odor. This is not
सॉरी,
sulfur. It's sulfuric acid.
एंटीफ्लू में तो
This
aversion to cold bath.
cold bath है, हाँ. There's nothing like related to sour. Okay. This one, body has a filthy smell even after bathing. Filthy, इसमें sour नहीं. There's a filthy word. Someone was saying Suriname,
Bench
so
में
Suriname is, no, this one is Suriname. Filthy is Suriname. This one, breath and body smell foul. Which medicine? It is mercurius. So C. Sour odor of the whole body, calcarea carb, diarrhea. If it is added, Heparsal. Sour smell of whole body even after washing, this is Rheum. Sour smell of whole body is mac carb. Child has a sour odor despite careful washing. Careful washing. This is even after washing or bathing. This is careful. This is sulfuric acid. Filthy is Suriname. Foul is mercurius. Upper third of lung is affected in calcarea carb. This is a symptom. Arsenic album in bracket. This one, lower lobe of left lung.
ब्रायोनिया.
No, not brainia. This is ब्रैकेट नहीं दिया हुआ, एंड ये जो क्वेश्चन था, दिस हैज कम इन यूपीएससी. ठीक है, तो दिस वन इज natrum sulf. ये मैच द फॉलोइंग में आया था एक बार. ठीक है, ऐसा. अपर लेफ्ट, दिस वन इज सल्फर एंड myristica. इट इज गिवन इन ब्रैकेट ओनली. कैलकेरिया का कुछ कुछ दिया है, कुछ कुछ नहीं है. बेस ऑफ द राइट इज
लाइको.
लाइको. Violent stitches in upper left chest below the scapula extending to neck. Which medicine? This is Theridion. This one affects the lower lobe of right lung, stitches through the back.
चिलिडोनियम.
Mercurius. Chelidonium में है, but that is मतलब that is inner angle of scapula, जो वो मेन वाला लाइन है, but that is particularly not for lung. ठीक है, तो you can add it like just to remember कि okay fine symptom है, but yeah, you can add it in third bracket में करके ऐसे. This one, pneumonia of right lung, liver complications.
वो चिलिडोनियम.
हाँ, Chelidonium, very good.
मैम एक बार फिर से पढ़ा दीजिए
हाँ,
लंग वाला.
sure. See this one. Upper third of right lung is calcarea carb, arsenic. Lower lobe of left lung, natrum sulf. Upper left is sulfur and myristica. Base में अगर है, that is lico. Upper third, upper and right, arsenic, calcarea. Lower left, natrum sulf. Upper left, sulfur, myristica. Base is lico. Now this one, violent stitches in upper left chest below the scapula extending to neck, that is Theridion. If it affects the lower lobe of right lung, stitches through back. अगर back में stitch कर रहा है, अगर extending to neck है, that is Theridion. अगर back में है, that is Mercurius. And Chelidonium, pneumonia of right lung with liver complication, that is Chelidonium. Okay. This one. Rawness of soles of feet from perspiration, blisters and offensive foot sweat. Which a foot sweat between the toes, making them offensive on soles as if he had stepped into cold water. ये पहले भी हम लोग अभी एक symptom similar same वाला ही discuss कर चुके हैं. This one is from calcarea, yellow one, and this one is step into cold water. Stanicula, this one is important step. Ailments caused by suppressed foot sweat. Ailments. This is silicea. Ailments अगर है तो. Okay. Now this one is easy. I know everybody knows about this. Painless wholeness
स्क्रीन थोड़ा ऊपर
aggravation.
कीजिएगा.
हाँ. This one.
ओके
Foot
मैम.
sweat between the. Done, no? Okay. Okay, this one to knows everyone, that painless hoarseness aggravation in the morning, calcarea. This one. Just a second. Okay. This one is hoarseness with hoarseness aggravation in the evening. Which medicine? Am I audible now? अच्छा, am I audible? एक बार please मतलब
Yes,
confirm
ma'am.
करो. Okay, fine.
वो वाला
Okay,
कार्बोवेज
hoarseness. हाँ, that is carbovage and phosphorus. Hoarseness with rawness and aphonia aggravation in the morning. Very good. This is causticum.
Argentum, ma'am.
No, this is causticum. This aphonia है वहां पे, but this one aggravation in the evening is not there. Now this one. Rachitic cranial bones, thin and brittle fontanelles and sutures remain open, too long or too close, and reopen, delayed or complicated teething. This is calcarea force. Now this one, scrofulous rachitic children with large head, open fontanelles and sutures, much sweating about the
Silesia.
head. Very good. This is silesia. This one, non-union of bones promotes callus is calcarea force. This one facilitates union of fractured bone,
Ruta.
favors production. This is not ruta.
Sorry,
When
hypericum.
trouble,
Hypericum.
not hypericum.
Uric acid.
This
Calendula,
is
ma'am.
symphytum. 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 अच्छा, ये वाला headache of school girls. It is in calcarea force. In bracket we have sorinum natrium. This one, headache anemic old school girls. Which medicine? This is
Phosphoric
natrium.
acid.
Sodium.
Natrium. Phosphoric में I think headache है क्या? कैप का कुछ है शायद.
कैल्फॉस
एक बार
में है.
देख लें. कैल्फॉस में तो we studied कैल्फॉस वाला अभी. अच्छा, this one. Children emaciated, unable to
मैकफॉस बोल
stand.
रहा था. मैकफॉस में भी है.
Headache of
Mac
school
first में.
girls from eye
Okay,
strain
Mac.
or overuse of eye.
This is in Mac first, right? Okay.
No, ma'am.
So,
Phosphoric acid.
oh, phosphoric acid में. Okay. So add phosphoric here. Mac first में क्या है? इन स्कूल गर्ल्स में add phosphoric acid. अगर Mac first होगा तो add कर लेना उसको भी.
ट्यूबरकुलिनम में भी है. मैकफॉस में भी है. कुछ तो है.
अच्छा, you just check. अगर रहा तो please add that one. Headache, anemic. Okay, children emaciated, unable to stand, slow in learning to walk. It is in calcarea for this one. Children slow in learning to walk.
Natrium.
No, this is not natrium. This is causticum.
मैम नेट्रम में भी है.
Only in slow in learning to walk. What is written?
चिल्ड्रन स्लो इन लर्निंग टू वर्क.
Okay, so this one is also in natrium. Same symptom. Also in natrium. Okay, calendula I've not added. ऐसा कुछ था नहीं. Or
मैम थोड़ा ऊपर
probably we
से.
had covered. Yeah. Done?
और थोड़ा ऊपर में. ओके मैम.
Okay. So camphor. Camphor, surface cold to touch yet cannot bear to be covered. This is a symptom of camphor. Now this one, the skin feels cold to touch,
लीडम.
yet the patient, which medicine?
लीडम.
Not ledum. This one is sickle. लीडम में है, लीडम में, बट ऐसा शायद नहीं है। आई चेक। Ledum is that the coldness is there, that bed covering us. Parts cold to touch, but not cold subjectively to the patient. There's not like cannot cover wala, not there, cannot tolerate. So yes, you can add, like, remember, rather yaad rakhne ke liye, you can add it in like third bracket. Usme. Okay, this one. Entire body painfully sensitive to touch. It's a symptom of camphor. Now, this one, painful
मेडो
stiffness of
Medran.
every joint. Meadow. Very good. This is meadow. And the second one, the whole body painful, easily sprained and injured. This is sorinum. I think there are other lines also, similar lines also in other medicines. If I get, I'll definitely add. If you get, you also add. So this one, great coldness of the surface with sudden and complete prostration of the vital force. It's a symptom of camphor. This one, adapted to diseases with rapid sinking of the vital force, complete prostration and collapse. Which
Uric
medicine?
acid.
Veratrum. Very good. Second one, circulation feeble, stagnated, and vital heat sinks to minimum.
कार्बो
This one is
China.
carbo animalis.
Carbo.
Animalis. This one, profound prostration and collapse, surface pale and bathed in cold sweat. This one is carbolic acid. This one, face pale, blue, collapsed, features sunken and hypocritic red, while line
Aconite.
becomes. Aconite is definitely is there.
Ferret.
Bracket में aconite में भी है ऐसा symptom.
Phosphorus.
This is in veratrum. उसके bracket में ही दिया है aconite. Aconite में there is a rising from recumbent position. Recumbent one is the word is there. Okay. Cancerous oversensitiveness में cancerous का बहुत अच्छा वो symptoms है. We had covered that in previous class, so please उसको अच्छे से देख लेना. Cancerous, this one, stool passage of white or pale red, tough mucus like scraping from the intestine with streaks of blood. This one, autumnal dysentery discharges from bowels contain white
Colchicum.
shreddy particles. Which medicine is this?
Colchicum.
Colchicum. Very good. Okay, this one, carboanimalase, glands indurated, swollen, painful in neck. This is an carboanimalase. This one, glandular induration of stony hardness of mammae and testicles in person, cancerous tendency after bruises and injuries of gland. Which medicine? It's conium. Injuries of gland, this is conium. This one, this is important. Ankles turns when walking. It's in carboanimalase. Symptoms similar is easy spraining of ankles and feet. Which medicine?
Freedom.
Very good. This is Lidum. This one, easy dislocation and spraining of ankles.
Medorrhinum.
No, not Medorrhina. It's natrum carb. अच्छा, in graphitis also I think there's something related to ankle. अगर proper नहीं भी है तो इसको please एक बार check करके add कर लेना. Bad effects from loss of vital fluids, hemorrhage from any broken down condition of mucous membrane. This is in carbo-veg. This one, for stout, swarthy persons of system once robust, which have become debilitated, broken down from exhausting discharges. Which
First one,
medicine?
China.
This is China. Very good. Or Syncona, whatever. Ailments from loss of vital fluids, especially hemorrhage.
Aram.
This is also Syncona. Best suited to person of originally strong constitution who have become debilitated by loss of vital fluids. This is what you are saying, acid force. This one, weakness and weariness from loss of vital fluids. Weariness, which one? This is phosphorus. Weariness. After loss of fluids or vitality, particularly in the anemic. Which medicine? It's Calicarb, particularly in anemic is Calicarb. Okay, this one. For the bad effects of exhausting diseases, whether in young or old, it's carbo-veg. This one, disturbed functional activity of brain and spinal cord from exhausting diseases or severe mental shock resulting in paralysis. Which medicine? This one is, which one?
Picric.
Postigum.
No, this posticum. Okay, desire to be fanned in carbo-veg. This one, so you all know, wants to be fanned all the time.
Carbo-veg.
Desire to be constantly fanned in carbo-veg. Wants to be fanned all the time. Which medicine?
Lettuce.
No, this is
Lettuce.
Medo. Medo. This one. Longing for whiskey and tobacco. It's in carbolic acid. This one. Unconquerable longing for alcohol. We
Asaram.
just studied now. Asaram. This one. Old toppers crave whiskey and brandy. Carbo-veg.
Sulfur.
Very good. This one, longing for alcohols, liquors, and tobacco for the accustomed stimulants. This one is coca. अच्छा, drooping of upper
मैम एक मिनट
eyelids.
स्लाइड ऊपर.
हाँ हाँ sure.
Thank you.
अच्छा, drooping of upper eyelids cannot keep them open. Causticum में है. अच्छा, this one is homework. Upper eyelids heavy, has to raise them with fingers.
Gelsemium.
कैली बाइक्रोम कैली कार्बोनियम.
Calicarb. This is Calicarb. Okay, this one. Great heaviness of the lids cannot keep them open.
Gelsemium.
Very good. This is gelsemium. Eczema of lids, eruption, moist and fissured lids, red and margins covered with scales or crusts.
Petroleum.
No, this is graphitis. This one, drooping of both lids.
Opium.
This is sepia. ब्रैकेट में दिया है इसका. Okay.
मैम थोड़ा
So
ऊपर
this
कीजिए.
one, हाँ, ठीक है. So upper irid heavy, this one calicut, great heaviness of the lids, cannot keep them open is gels. Eczema of lids eruption, that is graphitis, drooping of both lids, it is sepia. Sepia का proper medicine में नहीं है, but if you go to your this medicine causticum and gels, उसमें bracket में दोनों में है. This one. Must move constantly, but motion aggravates the pain. This is a symptom of causticum. Now this one, must change position frequently, but it is painful and gives little relief.
Natrum sulf.
Very good. This is natrum sulf. Second one, constant desire to be moved, but motion. This is
Paroxysm.
no. This is phyto. Phytolacca bracket में we have laccan and mercurius. It's laccan. Acha, pain obliged to move limbs frequently as motion gives relief, renewed by contact and then gradually increases to a great height. This is cinchona. Okay. Cicatrices, especially burns, scalds, freshen up, become sore again. This is of your causticum, but old cicatrices become red
Graphitis.
around edges. Gravitis. Very good. This one. Nipples inflamed, tender to touch. Chamomilla. This one, nipples painful and tender. Which medicine? This is Helonius. This one, sensitive, sore, fissured.
Phyto.
Phyto. Very good. This one, cracks of fingers in ends and fingers,
That
nipples, labial.
Silex.
This is not silesia. This is graphitis. Acha, this one, burning of soles at night and puts feet out of bed. Chamomilla. Okay? Now this one, burning of hands and feet wants them covered and fanned.
Pepper.
No, this is your meadow. Cold feet in daytime with burning soles at night wants to find a cool place for them.
Sulfur.
Very good. This is sulfur. Burning soles of feet must uncover or put them in a cool place.
Camphoric.
This is sanicula.
मैम थोड़ा स्क्रीन
Yellow
ऊपर
gray.
कीजिए.
हाँ.
Okay मैम.
On. Okay. Yellow gray color of the skin, wilted skin of the palms and hands. This is Chelidonium. This one, yellowness of the face, conjunctiva, yellow spot on the chest, telltale face. Which medicine?
सीपिया
कैरम
Telltale,
या सीपिया,
sepia.
दोनों में से कोई एक है।
Very. Telltale is sepia only. Yellowness है तो sepia. Okay, this one. Right foot cold as ice, left natural. This one is chelidonium. This one hand ice cold, the other warm.
कैमोमिला
Not chamomilla,
तो चाइना
cinchona. Chamomilla में है कुछ ऐसा?
कैमोमिला भी सिनकोना में दोनों का सेम सिम्टम ही है।
Okay. Chamomile. This one foot hot and the other cold. Which medicine? Lyco. This one hands icy cold, body warm. Tobacco. This one legs icy cold from knees down. This is also tobacco. Okay, so right foot cold as if ice, left neutrals is your carbo veg. Then this one, sorry, chelidonium. One hand icy cold and the other warm is China and chamomilla. One foot hot and the other cold Daico. Hands icy cold, body warm tabacum. Legs icy cold from knees down. That is also tabacum. Eczema, no itching, exudation from into hard lemon colored pus. That is cicuta. This one, itching without eruption.
सुराइनम,
Dolichus.
No. Dolichos.
डोलिकस।
Yes. Okay. This is Dolichos. Brain disease from suppressed eruption, it is in cicuta. And this one, chorea from suppressed eruption from fright.
जिनकम
Zincum. Very good. Cinchona, unrefreshing sleep or constant supper, aggravation 3M, weeks easily. This one. Unrefreshing sleep, more tired on rising than when retiring.
Macphos. नहीं,
Not
Maccar.
MacPhos, MacCarb. MacCarb is it? No. Lachesis में there is aggravation into sleep. Unrefreshing wala, it's not proper written. But this is MacCarb. MacCarb के bracket में बहुत सारे medicines है, एक बार देख लेना. That can come in all of the above or that type of question. Okay, general coldness, sometimes convulsion. This is cinchona. Now this one, coldness general of single part.
Calcarea.
Very good, Calcarea card. Sweat profusely all over on being covered or during sleep. And this one, sweat day and night as soon as one sleeps or even when closing the eyes.
Conium.
This is the China. This one is, yes, very good. This is conium. Okay. This one. Cophia, this one, headache one-sided as from a nail driven into the brain as if brain were torn or dashed to pieces, worse in open air. This is cophia. Brain or dashed to pieces. This one, as if nail was driven out through the side.
Ignitia.
You're right.
Ignitia.
You're right. Ignatia. Okay, second one.
phosphoric acid.
No, this is not phosphoric. This is thuja. Parietal bone is thuja. Okay, this one. Pain go from left to right. This is colchicum. Left-sided, principally affected. Which medicine?
Ammonium carb. नहीं, right side. Sorry.
Ammonium is right-sided. Principally affected. That is lachesis.
Lachesis.
और ये वाला affects principally left side of the body. This is
William T.
lactan. William tick क्या है ये? Let me check. This is William tick. Sorry, William tick. Affects principally. That is William tick.
मैम थोड़ा स्क्रीन ऊपर कीजिएगा ना, स्क्रीन.
हाँ.
ओके मैम.
Breast sore, hard and painful before and during menses. That is conium. This one, breast inflamed, painful, aggravation by loose jar
Bryonia.
towards evening. Short, it is bryonia. Must hold them
Black-
firmly when
black
going
tan.
up. Lactan. The second one is bryonia. Support. This is not support. Support is a beard. And supported, this is bryonia. This one. Headache during climacteric, throbbing, pulsating, aggravation during 2 or 3 days of accustomed menstrual flow, nervous menstrual headache before and during after flow. Focus. This one, displacement, menstrual irregularities and irritable heart. Why I have added this? Because this one is related to headache.
William Pig.
Yeah, this one is Lilium. Okay. So, tongue fiery red, smooth and polished. This is Protellus. And this one, tongue large, flabby, clean, smooth, as if varnished, fiery
Erosion.
red, dry red, articulation difficult. Which one? Pyrogen. Very good. This one, this one is Terebin. Terebin. Okay, so for today, we'll finish it here as I had provided 2 hours. Acha, rest medicines are left. If I get class to like in next week,
मैम थोड़ा
so I'll
एकदम
finish it.
स्टार्टिंग से एक बार दिखाइएगा ना, एकदम स्टार्टिंग वाला.
Starting wala. Okay. यहाँ से
ओके मैम, थोड़ा नीचे.
हाँ
और थोड़ा नीचे मैम. ओके मैम, हो गया.
okay, then if I get like class on next week, if they'll provide me, then I'll try to finish it. मतलब पूरा ही कोशिश करूंगी finish करने का and हो जाएगा क्योंकि most of the comparative symptoms we have covered in मतलब पिछला भी जितना सारा है, मोस्ट ऑफ इट, कुछ कुछ लेफ्ट होगा इंडिविजुअल मेडिसिन में. तो आई ट्राई टू फिनिश इट इन वन क्लास एंड विल फिनिश इट. 2 hours का होगा तो विल फिनिश इट. तो ठीक है. आई होप नाउ एवरीथिंग इज क्लियर. अगर कुछ क्वेश्चंस रहेगा तो यू कैन आस्क.
मैम थोड़ा सा एक बार स्लाइड ऊपर कीजिएगा.
देखो,
हो गया मैम.
दिस वन हो गया. ओके. ओके देन वी आर साइनिंग ऑफ. तुम लोग भी अगर क्लास का मतलब सपोज करो देयर इफ डिले या 1 हफ्ते से ज्यादा हो रहा है, ऐसा नहीं है कि बैठना है. यू विल ऑल्सो ट्राई टू फाइंड द कंपैरेटिव सिम्टम्स और ऐसा. तो खुद का भी एक अपना जबरदस्त जो है, यू ट्राई टू प्रिपेयर दैट नोट. ओके. सो ओके देन, साइनिंग ऑफ फॉर टुडे. नेक्स्ट क्लास में विल फिनिश इट मटेरियल जो भी है. ओके देन, थैंक यू. Thanks a lot. Have a good day.